How do you evaluate a child and diagnose them as autistic? Like, what goes into that?
To diagnose a child, it's usually someone around the child is noticing a delay or a difference in behavior. So that could be delayed speech. They might be nonverbal. They might be having difficulty with changes in routine or inflexibility, or they might not be meeting social developmental cues like smiling on time or doing joint attention. So that could be, pointing at something and wanting their parent to look at what they're pointing at. So it could be noticed by a pediatrician, a teacher, or a parent. And that's when they would go in for evaluation.
Yeah, and this is so sensitive because, imagine your parents, you have a young child, they're 1, they're 2, they're very young. And now you're noticing that, hey, is something different with my child? They're not necessarily keeping up with the milestones of development of their peers. Something seems different relative to the other children in the same age bracket. And, I would believe and I would understand that there's probably a lot of trepidation with, okay, let's take our kid and have him tested and potentially diagnosed with something. Maybe they're not even considering autism. And I imagine a lot of patients want to wait and see, like, okay, are they just going to catch up? Is there some threshold that you would want to wait to see to actually bring the child to be evaluated?
I think as soon as you start to notice those delays, it is a good idea to just get an evaluation, because then you can help that child be set up with services and supports. So for example, if they're having a little bit of a speech delay, they might benefit from seeing a speech therapist, which you could get through the school or through different funding sources. So it's helpful to have that early evaluation just to understand where the child is. And then over time, they might overcome that and start presenting like a neurotypical kid. So it might change over time, but it's a good idea to get services as soon as possible.